Hi, my name is Chris Potter. I'm currently a student at Goshen College, and I'm uploading this video as an assignment for professional communications, giving an informative speech on reversing type 2 diabetes. Maybe somewhere's in there, the question is, maybe why aren't we trying to reverse type 2 diabetes? Having been an RN for the last 4 years in a hospital, it would be easy to think that having type 2 diabetes meant counting carbs, taking oral medications, getting injected with different types of insulin at different times. But there is a lot of, and a lifetime of that's what type 2 diabetes meant. But there's a lot of evidence out there, a lot of research out there that shows that that might not be the case, that there might be other options, that maybe we're not doing things right. And, the evidence also would show, the statistics would show that we're not doing things right because diabetes just continues to get worse and worse, and the numbers increase and increase. So, as simply put as it can be, I would say that what I have learned the past month or so is that type 2 diabetes means that you have too much fat around your vital organs. You have too much fat around your pancreas and liver so that they cannot function properly anymore. So that means that there are a couple of options. It really interests me, the newly diagnosed type 2 diabetic patients and what we're communicating to them. Because I personally have heard it said to them that this is a lifelong change. This is going to mean you have to do these things for the rest of your life. And that's what it is, kind of face it. But I think what we ought to be communicating to newly diagnosed type 2 diabetic patients is that you have a couple choices that you need to think about making right now. Are you going to be motivated enough? Do you have the willpower to do the things that are going to remove that fat from your pancreas and liver? Can you go out and lose the necessary amount of weight it's going to take to reap the benefits of that? Do you have the willpower to change your diet to a diet of protein shakes and low glycemic foods and plant-based, and add into that some exercise? And for some people, I think a new diagnosis of diabetes would motivate them enough to do that. And so them knowing that there's a possibility that making those changes can reverse it is something that they definitely need to hear. And I don't know that they all do hear that. Secondly, if you're not the type of person that you think you are strong enough, you don't have the willpower, you're not motivated enough to make those kind of changes, and maybe physically you just can't exercise and do the type of things necessary to do that, then maybe if your body mass index is great enough to where bariatric surgery is an option for you, then that's something that you need to hear and need to look at, because bariatric surgery will force that weight loss and that diet change upon you. There are many studies that have shown that with a low calorie diet, somewhat extreme at first, 600 calories a day, for 8 weeks, and almost in the first week, blood sugar levels normalize. And if you can continue that for 8 weeks, even with a small amount of weight gain, a small amount of weight put back on, the benefits of that type of change almost put people into remission. So I guess that's my point. What are we saying to newly diagnosed type 2 diabetes patients? Are we telling them that there's a couple of things that can reverse type 2 diabetes? Or, like I said in the beginning, why are we not trying to reverse type 2 diabetes? Are we just allowing the treatment to remain oral medications and injecting different types of insulin? That's the question. Why would we do that?